PHAMCAST. I'm your host, Margaret, and I'm rolling into segment 3. It goes too quickly with Dr. Carolyn Teske, my behavioral optometrist, one of our cherished ambassadors, and just a wealth of knowledge. I just love having conversations with you, Dr. Teske, and now we get to really roll up our sleeves, and this is what FAM is all about. Control what we can control. Yes, your genetics plays a role. Yes, your previous history, yes, plays a role. But that we can change our outcomes through getting into action and even change genetic expression when we consistently start to do things with our well-being. So now what I'd love to do with you, Dr. Teske, is really look at some of the eye conditions and what's in that preventative health toolbox that we can do, that we can control. So one of the first ones that comes to mind is macular degeneration. And I know that there are 2 types of that, wet and dry. And I just was asked this in clinic the other day by somebody. So can you, first of all, talk about what is AMD and what's the difference? And then let's stock the toolbox.
For sure. So macular degeneration, the macula is your central vision. So when you lose central vision because the receptors are depleted, in its dry form, that's when the receptors are damaged, but there's no fluid or leak below the retina.
Okay.
So when you have wet macular degeneration, there's fluid below that is then going to destroy the receptors even more so.
So it's worse.
Correct. However, slow progressive dry macular degeneration can also destroy vision.
Right.
It just doesn't necessarily do it as quickly.
Okay.
But you can change from dry macular degeneration to wet overnight.
Wow.
So I think there's never really been any huge discussions in terms of medical or pharmaceutical approaches to dry because reestablishing good receptors has been a challenge until now.
Wow.
Right. So when we look at what the root cause is truly of this disease, the backbone of the retina really is falling apart. So the best way to support not only your eyes and your vision, but just like the rest of your body, the best way to fuel your body with the best nutrients is food.
Okay.
And that's how we can prevent at least the progression of dry macular degeneration. And we do that with nutrients.
So what kind of nutrients? So food is medicine.
Absolutely. Anti-inflammatory foods.
Okay.
Right? So that's our avocado and our fish and our omega-3s. Your antioxidants, so that's your berries, right? So really, I had a patient say to me recently, she said, so what I'm eating for the rest of my body is really what's good for my eyes also.
Yeah.
Well, the eyes are living tissue, right?
Yeah.
So I think when you're preventing illness elsewhere, then certainly you can focus on your eyes also.
Oh, that's okay. Okay, now I understand. I mean, I knew generally, but I didn't know to that extent. And do you can people completely lose all of their vision?
It's generally central vision. So the macula is the central 10 degrees.
Okay.
But nothing says we can't have more than one eye disease. Right? So you could lose central vision and then also have glaucoma that in its early stages causes peripheral vision loss, right? So I think you have to control what you can.
Right.
And what you can is hopefully how you prevent things from happening.
Okay, so you just mentioned glaucoma. So let's talk about what's the definition of glaucoma. What is that? What does that mean? Who's more susceptible, or are there people that are more susceptible to it? And then let's stock the toolbox.
Sure. So glaucoma, for the most part, is an optic nerve disease. So disease to the optic nerve generally in the beginning affects peripheral vision first. Okay. So the receptors on the outer part of the eye are impacted. More and more we now consider glaucoma to be a vascular disease. So it all makes sense because it all works together.
Right.
So if you deliver less oxygen via less blood flow to the optic nerve, then you're more likely to be at risk for glaucoma.
Okay.
So your patients who have high blood pressure, your hypertensives, your diabetics, right? Poor perfusion to the retina, right? And to the optic nerve.
And some of those things are certainly the vascular things like blood pressure. It can be silent for a long time without them really realizing it until it's really high and they feel unwell.
Yes.
But you can see often through your exam when somebody is at risk, correct?
Yeah, absolutely. Both in terms of measuring intraocular pressure, which often is one of the signs of glaucoma, the pressure in the eye is high, or looking at retinal vessels.
Right.
You know, if you think about it, the eyes are the only part in the body where I can assess your circulation without cutting your skin.
Yeah, this is what's so interesting, because I love this stuff when you're showing my images of my eye when you take pictures, and I'd like to address that right now. You've got some of the best technology in terms of precision diagnostics of how you look at the eye. Is it the Optimap?
It sure is.
Yeah. So the Optimap in your office, and then you're showing me my images. I love to see it, and you're explaining to me what my eye looks like. But what I also love what you do is then you take it a step further. Even though my eye didn't necessarily didn't have anything alarming in it, you explain to me, well, here's what I would see if. Can you speak to that a little bit? Because sometimes it's in the not knowing, because it's silent. It's just like our muscles and our bones. Our bones are silent until we break. Yeah. But your bone quality is linked to lifestyle, and we can prevent that by using the REMS bone scan. The Optimap allows us to look, and with somebody like you saying, well, but hang on a minute here, here's what's happening. Maybe it hasn't manifested. They don't know they have high blood pressure. What do you see on that image?
So with retinal vessel change, that's when I'm looking for circulation change. So
right.
blood pressure, heart, diabetes, cholesterol.
Right.
At times I've seen clots, actually, you know, in those small little vessels, which is really dangerous. That's
right.
urgent care, right? Because those clots are coming from here. So then that patient's life is at risk. But
and when you said from here, for those of you that are only listening on Spotify, yes. Where are you pointing to, Dr. Teske? Because on television you're going to see that.
Blood vessels in the neck, yes.
In the neck, exactly.
From the carotids, yes.
From the carotid arteries.
And I think that's where, you know, sometimes our health system, well, I know our health system needs improvement, right? We need to work better together, right?
Absolutely.
And recognize that the head is attached to the heart via those blood vessels, and the eyes are fed by those same vessels. But it's also the nervous system, right? I've had the unfortunate experience of identifying a tumor, right? So this is melanoma.
Right.
And melanoma as a primary tumor in the eye is less common, but often it's metastatic from somewhere else in the body.
Yeah.
So then, you know, we need to make that referral to have the eye tumor addressed, but you also need to wonder then, is there a primary tumor elsewhere?
Is there something else going on? Right. Yeah. Yeah.
So, you know, you may be looking at your skin lesions for melanoma, but you can't really look inside your eye. You need someone else to look for you.
Yeah, that's so important. And so in terms of stocking the toolbox for somebody either with glaucoma or trying to prevent it, what are we doing?
So let's control our blood pressure.
Yeah.
Let's use tools like breath, which I think you've spoken of.
Absolutely.
To help slow down the heart rate and slow down, you know, or lower your blood pressure.
Yeah.
I think movement, right? So movement to increase circulation, right? Yeah. And you know, I'm learning every day that self-care really is a part-time job.
Oh my goodness!
You know?
Some days it feels like a full-time job. The older we get,
absolutely.
And because we don't recover as easy. There's a lot of science behind that too, stem cells and all as we age. But we can age well with grace and vitality when we are doing these preventative tools. And some of the things are simple as like you just talked about, breathing to lower blood pressure. Doing vagal nerve, yes, the dolphin's one thing, but there's other things. I just taught a workshop actually at a Reformer Pilates studio. Shout out to Lift, Flow, Grow, who's are also FAM partners. Off the Reformer, showing people how to handle what's in their nervous system toolbox and what can we be doing even with tapping and breath work and movement to stimulate the vagus nerve. And none of that costs money. So that's not the barrier, right? If your insurance doesn't cover the dolphin, or you can't afford that, or you can't afford to see a therapist that does that, there's things you can be doing, and breath and movement is a big one. Yeah.
For sure.
So diabetes, we can't talk about eye health and not talk about diabetes. In one of the earlier segments, if you didn't tune in, go back and watch. We talked about our collaboration working with a diabetic patient of yours where I was doing massage and microcurrent, and you, of course, sent them to me because of you knew they were diabetic and they had poor circulation, and we worked better together. This person was going to potentially have an amputation. And so let's talk about diabetes and how diabetes impacts the eyes, and then what we can do.
So three main diseases traditionally with diabetes that we are more at risk for. So bleeds in the retina, which, you know, they're silent until they're central. So again, you may feel like you have the tightest and the best sugar control, but you still could have eye disease. older statistic, but I think is still true. 90% of diabetics after 10 years will have some degree
Really?
of eye disease
Wow.
induced, whether or not they're controlled. Right. I think, between kidneys and eyes, those blood vessels are so fragile, they're just susceptible to damage.
Right.
So circulation issues, glaucoma, which we've talked about in terms of blood pressure, but also cataracts. More at risk for, cataracts at a younger age with diabetes.
Okay, so cataracts, let's talk about that. We did, and for those of you that are watching now, you might want to go back and watch our Insight on Eye Health series we did. Oh, is it more than 10 years ago now?
It's more than 10 years ago.
10 years ago. But it was a really cool integrative look at cataracts. So define cataracts for us, and many people have it for an obvious reason. Can you speak to what it is and explain what people can experience when they have cataract?
Sure. So the lens inside your eye, like the lens in a camera, becomes opaque. So it's clouded. In its early stages, much like the window in your car, when it's clouded on the inside, you don't realize exactly how clouded it is until you clean it,
right.
Or have someone clean it.
Right.
But that's early cataract. So sometimes patients are not even aware until they're measuring vision in the exam room. Glare at night often is a first symptom.
Oh, okay.
Again, like looking through a dirty window or through slightly dark sunglasses. Right, but because it's such a slow progressive change for most patients, then you often don't realize it until your vision is significantly affected. Now, thankfully, if you were going to pick anything to have these days, this is the problem that you want, because it is readily fixable by a good surgeon, and often some of my patients now who've had cataract surgery see better than I do, because they choose implants where their dependency on correction is less.
Oh my gosh, I can remember, rest my father's soul. This month he'll have been gone for 10 years, and when he had his cataract, my dad always wore glasses. So for me, that was my dad. His glasses were part of his identity for me as his child. Wow, he wanted nothing to do with those glasses once he had his cataracts, because look at me. And my mom and I were like, well, hang on a minute here. Like, it's not you. Like, it was so funny how that became part of who he was. But it really had improved that significantly
For sure.
with his cataract. Who's at risk for a cataract not going well?
Well, again, if the
From
retina
that surgery.
If the retina is not in good shape, so patients with macular problems, likely will still benefit from cataract removal because more light's getting in the eye.
Right.
Or patients who have the surface of the eye, the window at the surface, which is the cornea, clouded. And that can become clouded with dystrophies or other, eye-related diseases like keratoconus, or even dryness. Patients who have really severe dry eye from autoimmune disease or, environmental toxins, if the light won't get through, even if it's a nice clear lens, then vision will still be impacted.
And are all eye drops created equal?
Definitely not.
I knew the answer before you
definitely
asked. It was a
not,
rhetorical
for
question, but we
For
want
sure.
to explain why. So can you explain the types of drops perhaps that someone's going to put in their toolbox? Because that's something they can control.
For sure. So your vasoconstrictors, that's your Visine, Murine, Redaway, they basically take the blood vessels and shrink them. So the drop really just makes the blood vessels smaller, takes the red out. There's maybe a role for that. One day a year you're going to a wedding, your eyes were red because you didn't sleep the night before.
And you want to look your best.
Then we use those.
Right.
If you truly want to hydrate and lubricate, the longer lasting drops are better.
Okay.
So I think pretty commonly in lotions and shampoos and hair products and skin products, hyaluronate is very present, so hyaluronic acid. So an eye drop that has that type of ingredient needs to be used less often to achieve a better effect.
Okay.
So certainly in my world, if I use a more expensive drop but less often, that works so much better than using a more cost-effective drop that would have to be used more often,
Reapplied
which
and
of course I'm not going to do.
Right.
But I think it makes more sense. You're spending the same amount of money, but you're getting a better result with less work.
Right. And you've also recommended, I know for some of my family members, an eye mask, which can be really helpful too, which a lot of people don't realize. Not just the stress mask type, but an actual eye mask.
Yeah. So the eye drop is supplementing the the lacrimal component to the eye. When we're treating with an eye mask, we're impacting the eyelids. So the eyelids make the oil that holds the water in your eye. So often people say to me, oh, my eyes aren't dry, they weep all the time. But often weeping is that oil not holding the proper lubrication on the eye, and that's why it's weeping.
Okay.
So the eye mask, and you need wet, moist heat for a prolonged period of time. So 30 degrees for at least 5 minutes, ideally 10 minutes to open up those glands. So the skin around the eyes will impact what's going on the eyeball itself.
Yeah, and I mean, as a massage therapist, I mean, this is very common. I'm trained in hydrotherapy, and we know deep, moist heat penetrates deeper, does increase the circulation. I can completely see why that is so and has been effective for many of my family members. So before we wrap up here, I really, this excited me, just when we were off camera. You were talking about another one of our FAMBassadors. Her name is Joanne Rattay of Lymphatics Canada. She is another proud registered massage therapist. She has been a FAMBassador from the early days as well, and she is trained highly in lymphatic health, and I know has been instrumental in working alongside with you. Can you tell us, because this excites me to no end, this year in FAM, yes, we have the focused days and we have the themed weeks during Preventative Health Month where, you know, Eyes Are a Window to Your Health Day is February 17th and You'll Love Your Lymphatics Day is February the 14th. But here's where the story gets super cool and where we learn and grow from one another and truly practice preventative and integrative medicine. And that's when an optometrist and a massage therapist who's trained in lymphatics come together and show you how they work together to improve things. Tell me what you're doing with Joanne for this year Preventative Health Month. I am so excited because I just found this out. I love these self-starting leaders, these movements that are happening under the umbrella of FAM. This is so cool.
I think one of the things I've learned most working with you is some of the advice that I share with patients is often the same advice that you share with patients for different reasons.
For sure.
Right?
Yeah.
And one of the presenting symptoms often I hear to my chair is, you know, I have puffy around my eyes or my eye feels swollen. The eyeball itself is fine. But around the eye and draining, you know, or not draining, lymphatic blockage is often the cause of eye pain.
Yes.
So Joanne's been instrumental in my wellness journey. When you live in chronic stress, which I think most of us would admit we do, then a lot of our systems fail. And the lymphatic system, which is our detox system, is to drain all of those toxins to help, you know, our liver do what it's supposed to do. And if you have a clogged system, then nothing works properly.
Right.
So Joanne and I will collaborate on a video and show you how doing, you know, lymphatic drainage will be supportive for your eyes and your vision.
Love it. Breaking down silos, bringing regulated healthcare professionals together to learn, to grow from one another, but most importantly, to stock your preventative health toolbox. That's how we create legacy change in healthcare. And that's what joining the family, PHAMILY, really means. Dr. Teske, thank you so much. I always learn something when I sit next to you, and it's such a privilege and a pleasure to link arms and work better together. And I'm really excited where this preventative health movement is going. And it's because of people like you that believed and breathed belief into me, even when in the early days, everybody was kind of going, oh, well, that's a really cute idea. But you were like, no, we're in. I'm here and being supportive. I can't thank you enough because that's what's fueling me to continue to breathe belief into other inspired leaders so together we can make a difference. Thanks so much.
Well, thank you for leading it, and I could not be more thrilled to be part of it.
Well, you heard it here. We are better together as one, and the Preventative Health Awareness Movement 2026 is going to be epic. It's just exactly that. But as soon as March 1st hits, it's the preventative health movement all year long. If you want more information about Dr. Teske, make sure you're following her in socials. Of course, go get your eyes checked and make sure you tune in on Eyes Are a Window to Your Health Day on February the 17th. During FAM month. So on behalf of everybody here at Your TV, Dr. Teske, myself, all the FAMBassadors, until next time, be well and remember, a healthy tomorrow begins with prevention today. We'll see you all soon.